Hi, I'm Dr. Angie Settle with Your Health Done Right. Today I have a great guest. It's Melissa Green. She is a board-certified family nurse practitioner, and she also is a board-certified psychiatric mental health nurse practitioner, and make sure I got that right. She practices at our West Side office. Welcome, Melissa.
Thank you.
So first, I always like to get, a little bit about our guests, their background, where they grew up, that kind of thing, education. So tell me a little bit about that.
Well, I grew up in Charleston.
Mm-hmm.
I have been a nurse for 30-some years. Nurse practitioner for 3.5.
Mm-hmm.
I've been with Health Right for almost 4 years. Well, 4 years, yeah.
Mm-hmm.
And I received my master's degree from Walden, but my undergrad's from Marshall.
Yes.
So I have lots of experiences and
Absolutely.
in nursing.
Mm-hmm.
So.
Well,
yeah.
part of the great thing about Melissa is we have Bobby, who's I'm just cutting it, the psychiatric nurse practitioner on the East End. And then when you came on board, and I knew we had the West Side office, I was like, we really could use, another source of, behavioral health care on the West Side. And,
Right.
and I approached you and said, hey, would you be, you just came out of school, and it's like, oh, I just got school burnout. Would you be willing to go back and add this additional certification? Right. And thankfully you said yes. So we're blessed. Now that you've got that behind you. If you're like me, when I finished my doctorate, I'm like, I am never going back to school again. Never say never, though.
Right, exactly.
But that has been a great addition for the West Side, and I want to make sure that we talk about it.
Right.
So much stuff to talk about when you're talking about behavioral health, and we talk about it quite a bit. I had Dr. Thistlethwaite on my last show, but that's, with purpose, because I feel like behavioral health care, mental health, sometimes can be so stigmatized.
Correct.
Especially, like in the Mountain State, a lot of people, you got to be strong and, stoic and, toughen up. And I feel like you can't really talk about it enough because people don't always understand it, and they also don't realize how much it can impact your overall health.
Right.
So today we're basically going to be talking about, behavioral health in you and all aspects of that. So, and then we'll talk a little bit more about your practice and what we do on the West Side. We have a great office over there. We have 3 locations now. Of course, we have the East End Clinic that's been there forever and a day, it seems like, since 1990-ish? 2000. 1999 is when we moved over there. And then we have the West Side office, which we started in 2021, spring of 2021, and then the Covenant House office was 2019. So now we have 3 locations so that people that need help can go there. And we know that there are people all over West Virginia watching. So you may not be located near West Virginia Health Right, but we want to let you also know just about behavioral health, how important it is, and that so that people reach out. I just saw on the news yesterday, it's just bringing this up, about a college in Texas, which is close to MD Anderson, where my husband has gotten cancer treatment, but where a girl was shot and killed in her dorm. It was a murder-suicide. And, it just brings a lot of the mental health awareness to you about,
Right.
Sometimes things happen and people don't reach out. And it's so important to spread the word about the importance of it in all aspects. So that kind of, rooted home with me. We all have kids going back to college and things going on. So from all aspects of life, mental health can impact life from, kids, especially since the pandemic. How bad
definitely.
things got after COVID and people being enclosed and less socialization and all that kind of stuff, which we touched on the last show. But overall, just how important it is.
Right. And I've had several patients that have been college students, and they're coming in with the anxiety and the depression, and they're COVID kids. So they're trying to deal with coping of being in the college situation and their studies, living alone. So I've seen several college students.
Have you seen people? That brings me up. Have you seen people, because my kids, I have 8 kids, that went, through the COVID where we were trying to all be on computers and be at home and stuff, and that went on for a long time.
Right.
Have you seen any kids who are now not able to adjust to the social setting where now they're in a group and they're with people? Mm-hmm. You and I, I'm way older than you, but, we're used to being, around kids and stuff growing up. Like, I remember we didn't have computers and we didn't have cell phones. Everybody had to talk to everybody. You know what I mean? Now it's so tempting to just text somebody something now it's like you know, children, kids, you need to learn to have a conversation face to face. I was just telling my daughter the other day, she's wanting to send a text to somebody, and I'm like, no, this is a conversation you need to have face to face. That's not how you handle that. You need to go to that person and sit down and talk to them.
Right.
You know, in college. So, have you seen that?
I have. Like, they come in and they want to be on their phones, and they like, can you like put your phone down, please, so we can get to the bottom of why you've come in here. And
right.
But I even see that with my son. Like, I'm like, put the phone up. Like,
right.
I want to send a message. Well, why don't you just call? Like, they don't want to talk. They want to text, and their phone, their head's in their phone.
Right. So maybe those people who didn't even have social anxiety or issues that went through COVID and got used to being in the house. And now I even see with my teenage girls, now you're back in the classroom, dealing with all that middle school stuff and just the relationships and all of that.
Right.
That they didn't have to deal with before.
Exactly.
So it can add additional stress on our kids, that turn into adults like you're talking about, and then new people with anxiety and just a whole gamut of fun.
Yeah, I see patients come in and they'll say, socially, I have so much anxiety. Like, when I have to interact with people, I don't know what to do. I don't know how to handle it. So we try to talk through that.
Talk through that. Well, that's important. And I think people also can't underestimate, which you're not a therapist. We also have therapy services at Health Right. I know you have Krista, which her name is so hard to say.
Yeah, I'm not
going
even
to butcher
trying
it. But she's over there with you. So it's important that you get, the talk therapy, in addition to, somebody that can treat you behavioral health, look at medications, et cetera. So a lot of times those go hand in hand.
Correct.
Sometimes somebody may not opt for medications. They may just do talk therapy. Some people may get medications and they're just not comfortable with therapy, and that's okay. But I want to, tell people that we have both of those, and those both options are out there. And it's always confidential. Everything that you're telling somebody is confidential. I tell people, have you ever felt like you just wanted somebody to talk to and just to hear your side that's a lot of times what therapy is.
Correct.
When you're going through stressful situations. So I don't think you can underestimate that important part.
Right. Well,
as much. But tell me some of the most prominent conditions that you see. Some of the things that you're, a lot of the issues that you see in the population that you're serving.
Well, social anxiety is one of them, which we discussed. I'm seeing a lot of untreated ADHD patients, and they're coming in with anxiety and depression, and they're realizing they're having this anxiety and depression because their ADHD is not being treated. So they're having that extra anxiety in their life. So that's a big one I've probably seen a lot in the last 6 months.
Well, tell me, because I know it's changed a lot. Again, I'm a board-certified family nurse practitioner. I don't have the intensity and training in terms of behavioral health that you do. And, it's changed a lot. I think it's become more understood and diagnosed. But for people like myself who maybe grew up in the, as a kid of the 70s and everything, it wasn't as easily diagnosed or discussed as it is now.
Right.
Tell me some of the conditions that you're seeing, like symptoms that people out there may have, may not even realize that's what it is.
Well, I hear complaints of, I can't concentrate. I start a task. I go from here to there. I can go days and not finish the same task I started 2 days ago. I can't keep a job because I can't stay focused to do what I'm supposed to do. And then sometimes they talk about then they're moody with their families, but it's mainly that when they tell me I just can't concentrate, so, and then they put that on anxiety, which they've been diagnosed as a child maybe, and now you're an adult and you don't really. So that's how, that's the biggest complaint I hear is I can't concentrate and I can't keep my job.
Yeah. So that can impact kids in school.
Oh, yeah.
Teens as they grew up in high school, college students, and of course in the workplace. So that's another, important thing to mention if people are out there struggling. If viewers are out there struggling and they can resonate with that about having problems staying on task or having issues with their employment or anything like that, don't underestimate the power of, being seen and getting a good diagnosis and getting that treated, because that can make, I'm sure you've had success stories come back where people are like, oh my gosh, I didn't realize.
Yeah. They're like, oh, I'm like a different person. My family notices it. And I'm like, well, and I usually tell them, your family's going to notice things probably before you will, even with any depression or anxiety, but
So I'm sure that's frustrating to jump from task to task to task to task. I mean, we all do that from time to time, but if you're doing that every day and you're really struggling, that would be that'd be impossible to succeed. So that's important. So, and I think that's one thing too that's gotten better with modern behavioral health treatments, broader aspect, more understanding,
Right.
fine-tuning things. It's not just black, white, anxiety, depression, whatever, schizophrenia, bam. It's that they're understanding there's various shades, and that these symptoms could be this, and getting a
Correct.
more fine-tuning of it,
Right.
which you just recently went through your whole education, so I'm sure you've picked up more on that than I have. But that's kind of what I'm seeing from a distance.
Yeah, and you're correct.
Yeah, yeah. So tell me, what is in a typical day, like you say, we can't talk about HIPAA but if you say you had 10 patients, what percentage would you say would be like your typical anxiety, depression versus like ADHD or versus something like schizophrenia?
I bet 90% of my patients are depression and anxiety.
Yeah, and is it usually tied to situational depression?
Sometimes it's related to the family situation, or they're related to a job situation, or it's just been untreated for so long they're trying to figure out, why am I feeling this way? And so that's a big,
Which I understand from our patients, which we serve uninsured, low income, people that either have no insurance or Medicaid or Medicare, and they're all low income. So we already know that that's a huge stressor in their life.
Correct, yes.
They may be dealing with, be in a situation of domestic violence. They may be dealing in a situation where we have grandparents taking care of grandkids because their kids are incarcerated, or due to death or drug abuse or whatever. A lot of situations like that. People that get displaced, unemployed, things like that. So I know we see a lot of people struggling, but too. There's a genetic component, which we've talked about before.
Correct.
That people need to understand that a lot of times people this part I do know well, and I'm talking out, is that, there's a genetic component to it. And just like you can't pick your eye color and you can't pick, your hair color, you can change it though. Thank you, Clairol. That there's certain aspects of your genetics that you can't change. So predisposition to things like anxiety disorder, bipolar, depression, that kind of thing. You can't pick that. So there's got to be some understanding out there that, you need to treat this like other conditions, like somebody that, has high blood pressure, which you can modify things, or diabetes, you can modify things, but thyroid cancer and things like that, things that you have and you have like no control over. Sometimes there's certain aspects about mental health, behavioral health that you cannot change.
Right. You just need that little help. There's just that imbalance. You just need a little help there.
Need a little help there. Of course, you can take that walk. You can get out in the sun. You can socialize. You can not, crawl under your covers in your bed and try to avoid things. There's little things you can do to help, but there's something to be said for certain medications that stabilize, serotonin and all that kind of stuff as well.
Right.
Yeah. You agree?
I agree.
Yeah.
Yeah.
She knows more than I'm saying. And that's something I spent my career. So I've been a nurse since '93, and a nurse practitioner since '97. So I know early on it was so hard when talking to patients, when I would treat people, to just fight against that whole stigma. They go like, I shouldn't have to take a pill for this. That means I'm crazy, which I really hate when people say that. People need to understand that, it is just, like I said, it's just like any other aspect of your health care. And we need to normalize the fact that people, oh yeah, I see a therapist, or oh yeah, I get care for that, because gosh, how life-changing it is for people to do that.
Right.
Yeah, it really is, and to get things treated, because if mental health is off, everything is off. It's really, and I've seen people that I've treated and just how life-changing it can be to just, put them on the right medication, and just, it's like night and day.
It is. Yeah.
So I bet that's pretty rewarding.
It is. Yeah. I love when they come back and they say, oh, I feel so much better. It's very rewarding.
Yeah. So we do pretty good about access too. We try to get patients in the same day.
Correct.
We do appointments, but we'll take walk-ins, especially with mental health issues. Tell me what the phone number is over there if somebody wanted to call and make an appointment with you.
It's 304-340-1555.
1555. And then it's 511 Central Avenue.
Correct.
Our East End location is 1520 Washington Street East. Covenant House is on Shrewsbury Street. I don't know the exact number, but across from Capitol Market. But if anybody would ever find themselves in any kind of crisis, need of help or whatever, just walk in and ask for help, and we're definitely going to get you in. For those people out there in West Virginia, there are resources all over. I would encourage you to look for those, because behavioral health is not something that you want to sit on. It gets worse. And there's nothing at all wrong in getting help or having somebody, guide you to talk to with therapy or medications or whatever. So I want to make sure people understand that we in the medical field are not judging you. We love it when people come in and ask for help, and that's what we are here to do. We want to make sure people do that. And again, it's confidential. We're not going to tell anybody about whatever's upsetting you. I've even had a lady come through that was really, and I can relate because I love my dogs and my cats. She'd had a pet that died, and she was just distraught. And I've had people tell me, the loss of my pet was even worse than the loss of my grandmother or whatever. And even situations like that, people going through their support groups that we have, for grief and overcoming things like that. Even just getting through situational stuff. It doesn't mean that you're permanently going to need medicated or maybe need therapy, but getting through situations that are really tough and talking to other people who've experienced it too. And a neutral party is always good. So even if you're not comfortable talking to somebody one-on-one, if you get in those group settings.
Yeah,
absolutely. So tell me what is your favorite part of your position?
My favorite
And you do medical too, so you can talk about what's your favorite thing about working at West Virginia Health Rate, and act like I'm not your boss.
Well, I love seeing patients do well. I love seeing them come back and say, oh my gosh, it's been life-changing. My life is, my family notices a change in me. I'm a happier person. So it's rewarding when a patient, the therapy that you provide or the medication, and it works. Because everybody's different. Not everybody's going to have the same medication or the same regimen. So it's always nice when you get that right one and they come back and it's,
Yeah. And I think it's great. We had Dr. Dan on the show before. He's there for backup. You and I both know we're nurse practitioners. We're not physicians. We're not trying to be physicians. But what's unique about you, especially, is you have that family nurse practitioner, which you've had training, master's degree, certifications, national certification to treat anybody. I always tell people I can treat anybody from birth to death and everywhere in between. I just don't deliver babies. That's the only thing I can't do. You can do the prenatal care, aftercare, but I don't deliver babies. And then in addition, now you've got the mental health component. So that's really unique because you can see people, and if they have diabetes, if they have some other condition going on and anything's crossing over symptomatically, you can say, or you may be seeing somebody medically and you're picking up on something behavioral health or the behavioral health, and you happen to mention that they have diabetes and that their sugars aren't running well. You're uniquely trained and ready to do all of that.
And I enjoy diabetic patients. Those are fun. I love when I've seen those A1Cs come down. And but also, my son's a type 1, so I'm dealt with diabetes for many years with him, but so that's really rewarding to me when I deal with diabetic patients and see that and see
so I think that's really interesting about what we offer there. And then again, we have Bobby on the East End, is that it's not segmented care. I love nurse practitioners for that aspect, because you've got that broad training and now you've got that dual role, and we see so many patients that come in that aren't just dealing with one thing or two things or three things even. They're dealing with a whole gamut of things. And especially, when they're dealing with so many challenges financially, etc. We need to be ready to address all of those. And I like the fact that you're uniquely trained to do all of those things. And that we have somebody, again, on the East End, and we have somebody over on the West Side. Eventually, hopefully, maybe the Covenant House Clinic will grow. We might need one there. It's tiny, though. Brother Jim's over there. It's got 2 exam rooms, but we have Brother Jim, the nurse practitioner, and then we have Erin, who we've had on the show before, and she's a social worker / SUD recovery coach type person. So she handles all of that, and then she has some experience with behavioral health as well. So counselor. She's not a recovery coach, she's a behavioral health counselor. But she also is able to identify some people that are having issues. But someday maybe we'll get another one of you guys and have them there, so we have one at each place. But as we grow, it's important to address all those needs, especially.
She's been a good resource for me too.
Absolutely.
Some patients I've said that, she's been really good about helping patients with certain things. So
absolutely. So how do you feel about, this is another thing, sometimes people, to different providers or whatever, how do you feel about being a nurse practitioner overall? and how that is from day to day at Health Rate.
Well, I love being a nurse practitioner, and I feel like my many years as an RN, I really was able to bring a lot to, especially family. I mean, psych has been a little, it's not something you do as a regular nurse, but it's been a great addition to, I think, the experience that I have developed over the 30-some years I've been a nurse.
Yes.
So I love nursing. I've always said I wanted to be a nurse, and so I think family nurse and psychiatric nurse, that's just been like the icing on the cake for me right now.
Absolutely, yeah, so. I would agree. I think everybody brings things to the table. I do like the, nurse practitioners. Of course, I am one. You bring the nursing aspect of it. Nurses are known for their caring and, kind of the holistic thoughts. And, of course, we always have like Dr. Dan, and we have a medical director to back us up. We're not trying to wing it. And we always have these great specialists and wonderful volunteers, physicians that we can always rely on for those things that maybe are over our head and we refer out. But over the years, you get used to what you know and what you don't know, and you certainly know your limitations and don't go beyond that.
Correct.
But can really dig your heels in on those things that you're very experienced at. And I find it personally rewarding. I've got a lady that would contact me from year to year that I saw, 25 years ago, and she'd seen multiple people who misdiagnosed her husband, and I saw him and picked up on a cancer that got diagnosed early, and he's cured. And she will always reach out and say, wow, I just want to thank you. You saved my husband. It's just by the grace of God, on that day that you picked up on
something,
it and got it. But that's always rewarding, when you get that pat on the back that you're doing something right and you can make a difference in people's lives, I think, for sure. So I know that's what makes me come every day. And at Health Right, of course, we're always coming in there helping people, I think, in their greatest need. The
definitely.
toughest situations that, a lot of times we're their last resort. I don't want to think it's their last resort because we give great care, but a lot of times they don't know where else to turn.
Correct.
So they end up with us. What are some of the things, I just thought of this, what are some of the things out there that people can do, say they're experiencing behavioral health issues, over and above the medications? What are some of the things that you've found helpful to suggest to people that they can do that helps with mental health, over and above medications? I mean, like regimens of exercise or whatever, anything like that.
Well, I always, walking, like some type of exercise, if it's just walking around the block, and each day maybe increase it. Yoga and meditation. And sometimes when they, get in their job situations and they get comfortable with that, just working and getting out of the house, if they're able to do that. I mean, but I've seen that, I got my job now. I really feel better, and I can go to work now. Or, I'm just, just any type of exercise, find a hobby, if it's, I don't know, gardening or whatever you can do. And I know sometimes they're limited where they live, but just I always feel like being outdoors is like therapy for anybody. Just doing something, being outside, walking, yoga. I mean, just and a hobby. That's a big thing. So
yeah. Do you notice some people struggle more like on the weekends when they don't have like a set schedule? Or do you ever hear that? Or people seem to do better like at work, they have a certain schedule that they're following and tasked, and then as soon as they hit the door at home or whatever, when they're still in their time on their home, they're left with their own head and it gets worse.
I hear that more from like mothers who have kids in school. When Monday through Friday their kids are in school, and then the weekends they're like, my anxiety is out there, because they're overwhelmed. They're overwhelmed. They're not structured.
Right.
But Monday through Friday they're structured. They know where those kids are going. They know what they got to do. But then the weekends it's like a free for all. So.
Yeah, and I think too there's something to be said about, society, how fast paced it is, and, like cell phones. And, back in the day, I'm just thinking about, I'm going to age myself, like even dating. And, I remember when somebody had to call my house, and my dad would be like, now who is this and how do you know my daughter? You'd have to go through all of that just to get to him on the phone, you know what I mean? And now it's like kids are like on these apps and social media and texting and all this cyberbullying, all this stuff, but it's just so quick. And everything's so fast paced, and even you can get overwhelmed. I know myself with my busy life, you open your phone and there's like 30 text messages, and you'll have all these conversations going, and it's so easy to feel overwhelmed with it.
Well, it's too convenient.
It's just too convenient. It is. And to know when you have to set those limits, and it's okay to put the phone down.
Right.
You know, they can wait. You can't answer every person immediately. And I think that has probably added a lot to anxiety and the whole just feeling overwhelmed all the time, like you're talking about.
Right. Yeah, I mean, you know, when we dated, you know, no guy was going to call my house at 11 o'clock at night. Now,
correct.
You know, now you have a cell phone. Oh, that guy just sent a text. You know, I mean,
right. It's so easy to go back and forth, and then if you're like my personality, you feel like you're going to take care of everything, and you're like trying to, like, suddenly you're just overwhelmed, and that's something that I've actually worked on over the last year. You know, I even quit Facebook and like altogether, like, you know, after hours, it's just too much. I have to. You know, you give to patients all day and work, and then, you know, I love taking care of people. So anybody that reaches out or messages me on Facebook,
you're going to do it. Yeah,
I feel like I had to do it before I knew it. It was like that's all I did. Right. So, you know, just to ground yourself and realize, okay, you have to take care of yourself sometimes and your family. Put it down.
Right.
You have to set some limits, and I think that that's so important for mental health as well.
Oh, definitely. Yeah.
Yeah, I think that's contributed a lot, this technology and here, there, and everywhere, and all these activities and where you got to be, and it can really get overwhelming.
And the pressures of I got to be the best at this, or I got to be in this sport, so it means I got to do this 5 days a week. I mean, just
and social media.
Social media.
My kids, I've you know, we could go do a whole show on that, which we may have you back, but. You know, everybody's posting this and that, and it's so quick, and, you know, it's just so crazy these days. It was just a different thing when we grew up. I mean, it was enough to be in your social circle and feel that stress, you know, among your peers, but now it's like everybody and everything, and it's just people posting this and these unrealistics, and then people like modifying their picture and making this look like this, and then suddenly this unrealistic goals and everything.
Right.
And we can talk about women in society and pressures there. You know, I raise girls and boys, but that in itself is enough to trigger a lot of anxiety and things like that. But
their looks, their weight. I mean, girls are so and some guys are too. But it's
absolutely
it's hard being a kid now.
It is for sure. Which can, you know, kids grow up into adults and have, you know, those lifelong problems, but.
Right.
Anyway, I can't thank you enough for coming on the show today. We all need to have you back. There's so many episodes that we could do, even just on social media and how it impacts kids and how that impacts adults and, you know, lifelong issues there. But I can't thank you enough for coming on. I really appreciate you, what you bring to the table, what you bring to Health Right, what you bring to our patients. I always tell, you know, a lot of times I have the opportunity and I get awards and whatever, but it always comes back to the staff and what they bring to the table and what they bring to our patients and the care that they give that make us what we are at Health Right, the success that we are. And at the end of the day, it's all about our patients. But thank you so much for coming on. I appreciate you
for everything you do for us.
Thank you, for sure. Thanks for coming on.
Thank you.
Join us next time, guys. Yeah.